Hello everyone, my name is Dr.Madhu Azad and my clinic is the Vitality International Homeo Clinic. It is at 4th Cross Keshwangunta, Tirupati, Andhra Pradesh. In this video, I am going to talk about a very common female problem, that is white discharge. It is also known as, in medical terms, leukorrhea. What are the causes, how you can manage it, and what is the normal discharge, what is the abnormal discharge. In this whole video, I am going to talk about everything in detail. So let's get started. So what is leukorrhea? There is a normal vaginal discharge, but when that vaginal discharge is increased, then we call it leukorrhea. So normal vaginal discharge is clear white in color. It is non-smelling, and sometimes normally also in normal conditions it can increase. So what are those normal conditions? In between the two periods, on 14th day, around the 14th day, before 14th day, after 14th day, the egg is released. That is known as ovulation. During ovulation, you might feel the increase in the white discharge. That is normal. In the pregnancy time, discharge is normal. When you are taking oral contraceptive pills, then you can have this increased white discharge. That is also normal. Before periods also, you can get increased discharge, normal. When you're about to menopause, like 45 years of age, some ladies get 40 years, 50 years. So before menopause also, the white discharge can increase. That is also normal. And because of stress also, like so much stress is going in the mind, that this discharge can increase. So this is known as physiological leukorrhea. Now I am going to talk about what is not normal discharge. Normal discharge is like starchy white, it can be curdly, it can be like pustular, green color, yellow color, foul smelling, like running whole throughout the period, and it is troubling you so much, and there might be itching, there might be hypersensitivity also, there might be burning also. So this is not normal. You need to take medicine for that. So what are the causes of white discharge or leukorrhea? There is uterus, there is the opening of uterus, cervix, and there is a passage known as vagina. When there are changes in cervix and when there are changes in vagina, then you can get leukorrhea. In cervix, there can be infection, cervicitis, cervical erosion, there can be polyp also. The vaginal causes are chronic constipation. Your stools are very tight, you are straining a lot. Because of chronic constipation also, the white discharge can increase. You are living a sedentary life, like work from home, no exercise, eating junk food, living alone, lots of stress, that can also increase your white discharge. If you have chronic pelvic inflammatory disease, congested ovaries, then also there is increase in white discharge. Another situation is when there is some infection, when there is some microorganism involved. What are the causes for that infection? Chlamydia infection, trichomonas infection, candida infection, bacterial infection, and endometrial cancer also, and gonorrheal discharge. Now I am going to talk about how you can prevent it or how you can manage it at home. Most important thing is that you should wash your private parts after stool and after passing urine. Every time when you go to pass urine and every time you go to pass stool, you have to wash your private parts. Not with the soap. Don't use harsh chemicals over there. It will irritate it and it will increase the vaginal discharge. So with normal water, you have to wash it. Second important thing is that you have to wear daily and make sure that you are drying them in the sunlight. If the humidity is there, if the undergarments are not dried in the sun, they will trap humidity, they will trap microorganisms, and you can get the infection. So very important, you dry them in the sunlight. Use protective method so that you don't transfer your infection or get infection from your partner during getting intimate. Now we talk about the treatment. So what is the treatment available? In homeopathy, we have lots of medicine for white discharge. In this video, I'm going to talk about most commonly used homeopathic medicines. First medicine is ALUMINA. The discharge is thin, watery and running down the heels. It feels hot. The discharge feels hot. There is constipation. There is so much straining with the soft stool. You pass soft stools, but it requires so much training. The female can be anemic. She can be pale and she have the desire of eating the chalks or starchy food or mud. So in this situation, we give ALUMINA. When the discharge is thick, it is like starch of egg. There is itching in their parts and there can be eczema also. Then the remedy is BORAX. If the discharge is yellow, it is acrid, there is burning, there is itching in the vulva, there is swelling, then the remedy is creosote. If there is so much itching, hypersensitivity and soreness in the parts and the discharge can be bluish white in color, then the remedy is AMBRA, GRISEA. Along with white discharge, itching, hypersensitivity. Hypersensitivity is there and itching is there, discharge is there, then the remedy is platinum. In creosote, it is burning, acridity, itching, creosote. In AMBRA GRISEA, there is soreness, there is swelling, there is itching, AMBRA GRISEA. In platinum, most important is hypersensitivity. How to take these medicines? For this, you have to consult a doctor because these are not the only remedies for leukorrhea. There are so many medicines. I can only talk about few medicines just for the awareness. So if you have to take the treatment, you have to consult your doctor. They can decide on which remedy, they can decide on how much to give and for how long you need treatment. If you want to consult me, you can send the message on my WhatsApp number. If you like this video, hit the like button. If you feel this video can be helpful for others, please share it with others. If you haven't subscribed, please subscribe my channel and hit the bell icon for notifications. Thank you so much for watching. Stay happy and stay healthy.